Celine G. Libao from 113 K3A, and for today I will be demonstrating how to provide a partial bed bath, shampooing, oral care, and back massage to a patient. And before starting any procedure, I will prepare all the necessary materials, perform hand hygiene, and explain the procedure to the patient and provide privacy throughout the procedure. Then next, I will check the patient chart and has his name and birth date. Sir, what is your name po and birth date?
Daniel B. Tapang, November 27, 2006.
Okay. Then next, first I will demonstrate how to provide partial bed bath. And before starting, I will review the patient charts for any physical activity limitations and prepare all the necessary materials at the bedside to save the time and energy. And next, I will perform the hand hygiene and of course, to wear gloves. So, a bed bath is, curtains, I'm going to close the door or curtains to provide privacy. And a bed bath is important because it promotes comfort, relaxation, cleanliness, and helps patients who are unable to bath themselves independently. And before beginning the bed bath, I will offer the patient a urinal or bed fan because warm water will stimulate body and prevent interruption of the procedure. So normally, the patient clothing should be removed to allow for proper cleaning of the chest and abdomen. However, for this demonstration, my patient requested to remove his clothing, and I respect the patient's preference. So, I will place a towel bedside the patient and wet the washcloth with water. And I will not use cleansers on the face to avoid skin irritation, and of course to the feet. And I will start by cleaning the patient's eye from the inner canthus to the outer canthus using a clean area of the washcloth for the eye. Going to and of course, a dry towel. And next, I will wash the patient's face, forehead, cheeks, ears, and neck. And of course, a wet towel. Then after that, I will place a towel under the patient and wash from behind. Sir, please. A wet towel. Forearm. So I will repeat the same procedure on the opposite arm, then rinse and fat the feet. Then next, I will place a towel under the patient's leg and wash from the foot upward toward the leg. So this. Okay. Wet towel. And So I will repeat the procedure on the other leg, rinse, pat dry, and cover the patient's leg afterward. Okay, so the next is the abdomen. Okay, then actually, normally the chest, abdomen, and pharyngeal area should also be clean, since my patient requested not to remove is clotting. I will respect the patient's wishes for this demonstration. In an actual clinical setting, towel should be used to maintain privacy while cleaning these areas. The next step is shampooing. Okay. Next, I will demonstrate shampooing, and I have prepared the necessary equipment, including the shampoo tray, pitcher of water, and dry towel. So I will position the shampoo tray under the patient's head and ensure proper drainage for the used water. Okay. So, a small amount of water, of course. To protect the patient's eye, I will place a dry washcloth or towel over them. Of course, a dry towel. And I will wet the patient's ear using water from the pitcher and apply an appropriate amount of shampoo and gently massage the scalp to the hair to remove dirt and oil. And if the patient has thick or dry hair, conditioner may be applied if necessary. Okay, going to apply shampoo, then massage, then next, small amount of water again. Okay, after shampooing, I will truly rinse the hair and remove the towel from the patient's eye and pat hair dryer. Finally, I will dress the patient to keep them warm and then comfortable after the procedure. And next is the oral care. Next, I will provide oral care for a conscious patient. And I have prepared the necessary materials, including a basin, toothbrush, toothpaste, cup of water, and plastic apron. And I will place the patient in a sitting position or high polar position to prevent aspiration, sir. Please. Okay. And I will perform a hand hygiene and wear gloves before starting the procedure. Oral care is important because it helps maintain oral hygiene and removes plaque, prevents bad breath, and promotes comfort. I will offer the basin to the patient and provide water for rinsing. Next, I will apply toothpaste to the toothbrush and begin brushing the patient's teeth using gentle strokes. And I will also brush the tongue to help prevent bad breath. And after brushing, I will provide water for rinsing and ask the patient to spit into the basin. And if available, I will flush the patient's teeth to remove plaque and food particles that the toothbrush cannot reach. And next is the back massage. So lastly, I will demonstrate a back massage. So I will position the patient comfortably in a side-lying or prone position and expose only the area, of course, that needs to be massaged while maintaining the patient's privacy. Okay, sir. And I will perform hand hygiene. Gloves may be worn if indicated. However, for comfort during massage, gloves are usually not necessary. So, I will apply a small amount of lotion or lubricant to my hands and warm it by rubbing my palms together. And I will massage the patient back while observing for any discomfort. And a back massage is important because it promotes relaxation, improves comfort, relieves muscle tension, and enhances the patient's sense of well-being. And after completing the massage, I will wipe off any excess lotion if necessary and reposition the patient comfortably. So I'm going to the dry. Sorry, please. So this is the conclusion. So that concludes my demonstration on facial bed bath, shampooing, oral care, and back massage. These procedures are important. First, nursing interventions that help maintain patient hygiene, promote comfort, and prevent complications and improve overall well-being. And bed bathing helps patients who cannot bath themselves. Shampooing keeps the scalp and hair clean. Oral care removes plaque and prevents bad breath. And back massage promotes relaxation and comfort. So thank you very much for watching and have a good day.